Hello friends, we have all been discussing time and again about various techniques of hair transplant, and we all know about FUT, which is follicular unit transplant, or the strip technique. And then the more popular one, FUE, follicular unit excision, also known as follicular unit extraction technique, which is very popular now. People who have been following us on our social media channels also know of our own technique, which we call the Perfect-i technique, which stands for permanent and real-time follicular extraction and implantation. So what exactly is Perfect-i technique? My name is Dr. Gaurang Krishna. I'm a hair transplant surgeon at Medlinks. In this video, we'll be discussing in detail about our signature Perfect-i technique, what are the advantages over the other technique, why we chose to completely shift our practice to the Perfect-i technique. Sometimes we combine it with FUT, but mostly why Perfect-i technique, and what are your benefits, what benefits do our patients get through this. So if you're interested in researching more about hair transplant techniques and what is the best way of doing a hair transplant, then this video is for you, and watch it till the end please. So let's start about the technical details of a hair transplant. In a hair transplant, we take out hair from back of the scalp, side of the scalp, sometimes the body, beard, which are what we call the permanent hair roots, and we implant it on the bald areas. So this is hair transplant. How we take out these hair from the donor area, that differs. So the conventional way was to take out a strip, take out a tissue from the back of the scalp, and then individually chop hair out of this tissue block. This was named the FUT, or the follicular unit transplant, and which was popular for many years. Then came the era of FUE, follicular unit excision, wherein instead of cutting a big strip, we take out each hair graft, which is a group of hair follicles, one by one. So that is follicular unit excision. Now the reason for this shift, see, FUT was working very well, but the reason for this shift primarily was better patient comfort. Just imagine a big piece of tissue taken out from your scalp and then stitched. Of course, it hurts a bit more. The scalp feels very stretchy, very tight, and it can also give you a very unsightly linear scar. To eliminate these problems for better patient comfort, faster recovery, less pain, and to avoid that linear scar, FUE technique was developed, and over the last, I would say, 8 to 10 years, it has become very popular. So much so that in an ICHRS survey that was done around 11-12 years back, 80 to 90% respondents said that they FUT only, and only 5 to 10% patients said that they do FUE either alone or along with FUT. In a more recent survey that was done 2-3 years back, 60 to 70% respondents said that they do FUE exclusively, and then the rest either did only FUT or did a combination of T. So you see this paradigm shift that has happened over the years, that service providers, surgeons, and patients both prefer FUE technique over the FUT, not because it gives us a better result, but because it is more comfortable procedure. The problem that we faced with FUE was there was a lot of storage outside the body. And we already knew, research had proven it, that for every hour of storage, for every hour that a hair spends out of your body, there is a 2% loss in volume. And beyond 6 hours, which is the golden period for any human tissue, the hair grafts, the hair follicles, they start to die. So not every hair that we were implanting was growing in the FUE technique. And so we thought to reduce the time that a hair graft spends after the body. And I'm talking this of 2014, 2015 time. And now in 2023-24, the whole world is now talking about how to minimize the time that a hair spends out of the body. In all the conferences, there are sessions to finish the surgery faster, to increase the turnover time, or what if we are storing, what kind of storage should be there, what temperature, what kind of liquid should be used so that the grafts don't die, and how to minimize the storage from 6 hours to maybe 2 hours or 3 hours. We have completely bypassed all these things, and here in Perfect-i technique, what we call the real time is that extraction and implantation, both the things go in simultaneously. Simultaneously means we already prepare the slits at the correct angle, correct density. We keep on extracting the hair from the back, and at the same time, we keep on implanting the hair on your bald areas. So the benefit is that within 10 minutes of extraction, the hair follicle goes back into the skin. And what better storage than your own skin, your own blood for a hair graft? No saline, no hypothermazole, no ringer lactate. It's your own tissue that is the best storage medium for your hair grafts. So that is where the idea of Prefect-i came in, and we did a lot of hit and trials, lot of different positions. We trained ourselves to bend our hand, to bend our body in a certain angle. We trained our technicians, we trained our support staff to sit very low and implant the hair in the reverse direction. The conventional hair implantation is from above downwards, but how we do it from below upwards. That's difficult, but now we are trained in doing that, and that's how the Prefect-i technique has become so successful, because it is eliminating the standard 8 to 10% loss that happens in over a 5-hour storage, and it also gives you a much faster result. So when a hair is immediately put back in the normal tissue, your own skin and blood, the chance of shock loss, the chance of post-operative hair shedding that you all know what it is, that is also much lesser. That's why many of our patients, and we have shared those results on our YouTube channel and our Instagram channel, is that many of our patients get a reasonable result just at the 3rd or 4th month period, which is unheard of. At most of the clinics, most of the centers, good centers, would say 6 months to 9 months to get some kind of a result, and you can do your Google search also. But here at Medlinks, patients who undergo the Prefect-i technique for their hair transplant, they get a much faster result. So it's not guaranteed, of course, nothing can be guaranteed, but this is what we see in majority of our patients, is much faster result. Another benefit for you is that the surgical duration is significantly reduced. Now imagine one surgery, FUE, let's say, where first the grafts are extracted, which will take, let's say, for a 3000 graft procedure, 3 to 4 hours. And after that, the slits are made, or before slits are made, then the grafts are now implanted, which takes another 2 to 3 hours. So a surgery takes minimum of 7 to 8 hour duration, start to finish. So just imagine a surgery of, let's say, 33,500 grafts, which is done through the FUE technique. About 4 hours of extraction and about 4 hours of implantation. 1 hour of slit making, that's 9 hours of working time stacked, plus the breaks that the patient takes, breaks that the doctor takes. A typical surgery lasts for 10 to 11 hours, which is a huge time. And that is the reason why many hair transplant clinics do not even attempt doing a 3000 or 3500 graft procedure in a single day. The surgery goes for 2 days. Whereas at Medlinks, we routinely finish 3500 graft surgeries in 5 to 5.5 hours. So it eliminates multiple problems. It eliminates the problem of coming back to the clinic on the second day, taking the anesthesia pain again, taking off from work again. And of course, it's a hassle. It also eliminates the risk of a overlong surgery on a single day. Why do we not want to do a 10-hour surgery in a single day? Because human fatigue factor always comes in. It comes from the patient side, it can come from the surgeon side. So once you start getting tired, once your eyes or once your hands start getting tired, the quality of course deteriorates. So we do not want our surgeries to last more than 6 hours. Third reason is the anesthesia that we use, the longest lasting anesthesia that we use, bupivacaine or ropivacaine, the effect lasts for 5 to 6 hours. And if I want my surgeries to go on for 10 hours, I have to repeat the entire anesthesia again after 6 hours, which causes complications, which causes anesthesia overdose, which can cause vasovagal syncope, which can cause a lot of swelling on the patient's head. So multiple things are avoided by doing extraction and implantation at the same time. Theory is different. Theory says that definitely if you're not storing the graft, the results will be better. But that's theory. What we actually see, what benefit you get, what benefit the patients get when we are doing the Prefect-i technique is, number one, a big surgery can be completed in much lesser time, in a single day, and even when we compare one single day in much lesser hours. So much better patient comfort levels, much better surgeon and surgical teams comfort level. Number two, faster results. A result that you normally expect around 8 to 9 months, many of our patients are getting it in 3 to 4 months. Number three, much better results. Many hair transplant clinics consider 80% growth as a super successful result. But here at Medlinks with the Perfect-i technique, anything which is below 90% is a failure. And we rectify it if that happens. Very, very unlikely, but sometimes we do see it. You can call it human error or it can be a matter of chance. But once in a year, we do have patients where the growth we felt was less than 90% and for us, it's a failure. We do corrective transplants in such cases. So, there are multiple advantages of this Perfect-i technique, this real-time and instant follicular extraction and implantation, and that is why at Medlinks, the most commonly performed hair transplant is through the Perfect-i technique. So folks, this was all about what we do in hair transplants at Medlinks, how we approach the Perfect-i technique, why we shifted from FUE to Perfect-i, and what are the advantages that our patients get through this technique. If you have any follow-up questions and if you have any further doubts about the Perfect-i technique, or if you have any contradictions to what I have said, please ask us in the comment section and we'll try to answer all your questions and we'll also try to satisfy your contradictions. Thank you so much. This is Dr. Gaurang Krishna signing off.